So, according to Massal Vanderay et al. 2022, the estimated prevalence of personality disorders in the Western world it ranges from 6% in the general population to as much as 45% in psychiatric outpatients. Now, there are 10 specific types of personality disorders, which are clustered into three different categories. Now, we call these clusters A, B, and cluster C. So cluster A resembles, I want you to think psychosis. Think odd or eccentric. Now, rarely do cluster A personality disorders actually get brought to clinical attention. So there are three disorders within cluster A, and they are paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Now, cluster B resembles mood. So think dramatic or emotional or impulsive. Now, often these do get brought to clinical attention. A lot of times they're easier to see the symptoms. So cluster B personality disorders, they have the same core symptoms, with main distinctions being in the level of severity as well as culturally mediated differences along gender lines. So what do I mean by this? Well, there are four different types of personality disorders. They are antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Now, the interesting thing is, two of these personality disorders are more prevalent in males, and two of them are more prevalent in females. So why is this? Well, when I said that they follow kind of some gender lines or seem culturally expressed gender lines, let's look at antisocial personality disorder real quick. So males are more commonly diagnosed, and according to Psychology Today, the most prevalent of males that have antisocial personality disorder are actually ones that have used drugs or alcohol or who are in prison. And why is this? Well, one of the common things that we see with people with antisocial personality disorders is they're aggressive, they're angry, they're mean, and a lot of times they're impulsive. And so that means a lot of times they get in more fights. Well, we look at gender roles and along those lines, and we see that to be more common with males. Borderline personality disorder, typically women, and they're almost 3 times as much as men to be diagnosed. Histrionic personality disorder, more common in women. Why is that? Well, this is one of those where it's people are trying to get attention. And a lot of times they do this within sexuality. And this differs from narcissistic personality that has 75% of diagnosis in males. Why? Histrionic is more sexual. Narcissistic tends to be more grandiose, or I have this larger than life attitude or view of myself. And so nothing's ever my fault. So when we look at gender roles and gender lines, typically we see more women sexualizing themselves and more men who are more likely to be looking at growing up or going up the corporate ladder or doing whatever it needs to take to get to that point. So that's one of the reasons why we see more women who are diagnosed with histrionic personality disorder and more men who are diagnosed with narcissistic personality disorder. Now, in the video, Cluster B, Borderline, Antisocial, Narcissistic, Histrionic Personality Disorder by Memorable Psychiatric and Neurology, it calls narcissistic personality disorder the trail of destruction. And why is it the trail of destruction? Because it has to do with relational problems, or in some cases, not being invited to something, or rejection, or failure, or in conflicts. Now, what I see over and over with a lot of these personality traits is they're masking vulnerabilities. They're masking insecurities. And when we look at cluster B, when I said that earlier, that a lot of the same symptoms are seen within them, I mean, that's the whole point, is they're masking different insecurities and vulnerabilities. So cluster C is our last one. And in this, I want you to think anxiety or anxious or fearful. Sometimes these do get brought to clinical attention, but not always. The three personality disorders within cluster C are avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder, or OCPD. And now OCPD is actually is the most prevalent personality disorders overall. And this is according to Dr. DeGenis White in 2017. Now, one thing is it's important to understand that obsessive compulsive personality disorder is different from another disorder we've heard of, and that's obsessive compulsive disorder. So obsessive compulsive personality disorder, or OCPD, is different from obsessive compulsive disorder, or OCD, which is classified as an anxiety disorder. So why is it different? Why is it a different classification? So one is people with personality disorders, they typically don't see that their behavior is an issue or that it's affecting people around them. A review by the Cleveland Clinic stated that people with personality disorders may not even recognize the negative effect that their behavior is even having on other people. They just don't know. Whereas people with anxiety disorders, they typically know what's going on and they don't want it to be going on. They see what's going on around them. They can understand their disorder, whereas people with more personality disorders don't typically recognize A, that they have a disorder, or B, that it's affecting those around them. So with cluster C, it's really important that we look at and understand the differences across cluster C, as well as across all the other disorders, because if we don't understand the differences, then we can't accurately get people the diagnosis that they need or the help that they need. Now, while anxiety and fear in cluster C, they're in common, each of the disorders, they manifest themselves. They come about differently. And if we don't have the right and accurate diagnosis, then there's no way that we can bring them the support that they need. There's no way that we can get them the help that they need, because each one of these disorders, no matter if it's cluster A, B, or C, requires that we go into trying to solve or try to effectively bring about the right therapy for them. If we don't understand it, and if we've labeled them with the wrong thing, then there's no way that we can really help them. We might be able to help them a little bit, but we're not getting to the point and we're not getting to the root. So it's important that we accurately diagnose patients.